Hi everyone, my name is Dr. Liza Ovington. We're here today to talk about recent developments in evidence-based medicine. In late 2016, there were 2 new clinical guidelines published in the peer-reviewed medical literature. Both contained recommendations for evidence-based practices to be considered in a comprehensive approach to reducing the risk of surgical site infection. I'm referring to the World Health Organization's inaugural Global Guidelines for the Prevention of Surgical Site Infection and the American College of Surgeons and Surgical Infection Society's Surgical Site Infection Guidelines 2016 update. The groundbreaking news that these 2 guidelines have in common is that for the first time, the choice of a wound closure device is recognized as an evidence-based component within a bundle of interventions aimed at addressing risk factors for surgical site infection. Both the WHO and the ACS SIS guidelines include recommendations for the use of triclosan-coated sutures for wound closure. The exact wording of each recommendation differs slightly. This difference may be in part related to the objectives and the evidence included, as well as the methods used for data analysis by each guideline group. Let's briefly discuss these differences for each guideline and consider how they arrived at their overall group of recommendations and the triclosan-coated sutures recommendation specifically. In this slide, we note first that with regard to guideline objectives, the World Health Organization stated that their intention was to provide recommendations for a comprehensive range of interventions during the preoperative, the intraoperative, and the postoperative periods. ACS-SIS was more focused, intending to update prior guidelines, referencing specifically the 1999 Centers for Disease Control Guideline for the Prevention of SSI, a 2014 update on strategies to prevent SSI in acute care hospitals by the Society for Healthcare Epidemiology of America and the Infectious Diseases Society of America, and finally a 2013 guideline on surgical antimicrobial prophylaxis by the American Society of Health System Pharmacists. Second, with regard to the methods used to identify evidence for each guideline's recommendations, the WHO performed literature searches in multiple medical, clinical, and scientific databases, whereas the ACS-SIS searched only in PubMed. The WHO effectively cast a broader net to identify relevant evidence. Searching beyond one database is important not only for ensuring that as many relevant studies as possible are identified, but also to minimize selection bias for those articles that are found in the search. Finally, with regard to the methods used to analyze the evidence retrieved from their respective literature searches, the WHO engaged in a more rigorous and quantitative process. For each recommendation, the WHO performed systematic literature reviews and meta-analyses of the relevant data. They also generated ratings for each intervention about the strength of the recommendation and the quality of the evidence. Meta-analysis is a statistical tool that can be effectively applied to synthesize evidence on the effects of an intervention from multiple trials. It provides a framework to evaluate a series of studies, usually randomized controlled trials, as a whole, rather than looking at each in isolation. Meta-analysis also provides a means to examine variations in treatment effects between individual studies as a function of various covariates, such as procedure type, wound classification, and so on. The ACS-SIS guideline did not perform any meta-analysis of their own, but opted for a more qualitative process. Their authors performed a narrative review of the identified evidence with recommendations based on experts' conclusions. Now let's talk about the overall recommendations and the recommendations regarding the use of triclosan-coated sutures specifically. The overall content or scope of the recommendations for each guideline was very similar in terms of the number of interventions and the topics. The WHO guideline consists of 29 recommendations overall, with 13 interventions relating to the preoperative period and 16 relating to the intraoperative and postoperative periods. The ACS-SIS guideline consists of 22 recommendations overall, with 5 categorized as pre-hospital interventions, 15 categorized as hospital interventions, and 2 categorized as post-discharge. A point of difference between the 2 guidelines with regard to the triclosan-coated sutures recommendation was in the specific clinical evidence reviewed. The ACS-SIS reviewed 1 randomized controlled trial in colorectal surgery from 2013, a 2013 meta-analysis of 17 randomized controlled trials, and a 2016 meta-analysis of 13 randomized controlled trials, including the 2013 colorectal RCT. As noted earlier, this evidence was reviewed subjectively with no further analysis. The World Health Organization Guideline reviewed 18 studies consisting of 13 randomized controlled trials and 5 large cohort studies. World Health Organization then performed a meta-analysis of the RCTs as well as of the observational studies separately and generated new data as to the effect size of the triclosan-coated sutures across the various studies. The WHO team was also able to perform meta-regression analyses to explore potential sources of variability across the studies, such as suture type, meaning monofilament versus braid, and wound or procedure type, meaning clean wounds such as cardiac and breast cancer surgery versus clean-contaminated wounds such as abdominal surgery. Both guidelines concluded that there was a benefit of using triclosan-coated sutures. The wording of each recommendation, however, varied slightly. The WHO guideline states, "The panel suggests the use of triclosan-coated sutures for the purpose of reducing the risk of surgical site infection independent of the type of surgery." The ACS/SIS guidelines state, "The use of triclosan-coated suture is recommended for wound closure in clean and clean-contaminated abdominal cases when available." Similar, but not quite the same. Let's discuss what likely led to this difference in the wording between the two guidelines. The key difference between the wording of the WHO and the ACS/SIS recommendations centers on the use of triclosan-coated sutures being in any type of surgery or in a subset of surgery types, independent of surgery type, or in clean and clean-contaminated abdominal surgery cases. This difference is probably based on what the evidence sources reviewed in each guideline showed. Recall that the ACS/SIS reviewed 3 sources, 1 RCT in colorectal surgery, and 2 different meta-analyses from 2013 and 2016. Both meta-analyses included randomized controlled trials of triclosan-coated sutures across a variety of surgery types, breast reconstruction, cardiac, abdominal, and others. While not all individual RCTs demonstrated a statistically significant effect of the antibacterial sutures in reducing SSI risk, both meta-analyses did demonstrate a significant effect when the studies were pooled, resulting in a larger number of patients and increased statistical power. However, in each of those meta-analyses, the authors then performed subgroup analyses, either by wound classification or by surgical procedure type. Subgroup analyses often result in a loss of power because you're then looking at fewer studies and patient numbers in each group. In both cases, the subgroup analysis for abdominal surgery included the largest number of patients and resulted in a significant effect in that subgroup, but not in the other subgroups with smaller numbers. Now also recall that the WHO reviewed 18 individual studies, 13 randomized controlled trials, and 5 large cohort studies. And rather than look at them individually, they performed a new meta-analysis of the RCTs and the observational cohort studies. That is to say, they generated new statistical data on the effects of triclosan-coated sutures. Further, they performed meta-regression analyses of the data to see if the effect varied with either suture type or surgical wound type. The WHO regression analysis showed that the type of surgical procedure did not change the effect of triclosan-coated sutures. Thus, they concluded that the effectiveness of triclosan-coated sutures for reducing the risk of SSI would not vary with the type of triclosan-coated suture, wound, or surgical procedure, and reflected this finding in their recommendation by stating, independent of surgery type. Therefore, the difference in wording is reflective of the differences in the data reviewed and in the method of analysis used between the two guidelines. Regardless of the specific nuances of the wording, 2 new and independent evidence-based clinical guidelines have now included the choice of a wound closure device as an evidence-based practice within a comprehensive approach to reducing the risk of surgical site infections. We encourage you to review all of the recommendations by downloading the full text of the guidelines from the respective websites of the World Health Organization and the American College of Surgeons. Thank you.